was early in the morning, just before dawn. Puan Naziha woke up like she always did and went to the toilet to take her morning shower. But suddenly she fell down. Hannah then quickly brought her to the local clinic.
Okay, Puan Nazia, so you just fell in the bathroom just now?
Yes, doctor. I just fell in the bedroom and my bed is so hurt. I don't know why.
Any numbness, tingling or weakness in the leg? Can you walk?
No numbness. I still can walk. It's just my bed is so hurt. I don't know why.
Alright, sounds like a bad strain. Alhamdulillah, nothing more serious for now. I give you some painkillers to help you ease the pain and relieve any swelling inside. So for now, you need a rest for a few days. No heavy liftings, no bending too much, okay? If the pain gets worse or you feel numbness or weakness later, please come back immediately.
Inshallah, I will be more careful.
Good. For now, I will write you the medication. You can take one tablet after meals twice a day, and if possible, apply a warm towel at the painful area.
Okay, thank you, doctor.
No problem, Puan Nazia. Take care of yourself, okay?
Okay, thank you so much.
Thank you, doctor.
After that, Puan Naziha and Hannah go back to the home. After being prescribed painkillers, Puan Naziha took the medicine according to the scheduled time.
I feel so relieved. I don't feel any pain.
Puan Naziha felt no pain at all after taking the painkillers.
Oh, I don't feel any pain. I can do all the home chores. Oh, my parcel.
She can lift and sweep without feeling any pain. However, the relief didn't last all day. After 2 weeks, she began to feel changes in her back.
I need to sit down. Oh, it hurts.
Puan Naziha, here your parcel. I put here. My parcel, yay! Oh my god, I can lift it. I think I just need Hannah's help. I just go inside.
She can no longer bend, she could not lift, and worse, walking. Something so simple had become a struggle. Every step was a reminder that something was wrong. She then go back to her home.
No, it's getting worse. I can't take this anymore. Hannah, take my medicine.
Yes, Mom. Mom, why? Are you okay?
No, I need to take my painkiller.
Okay, here you go, Mom. Here's some water. Mom, your condition is getting bad. Let's go to the hospital.
No, I'm scared to go to the hospital. I think I still can bear the pain. I think it will get better because I just take my painkiller. I think I just need some rest, okay? Don't worry, okay?
Okay, Mom. Mom, let me help you lay down. Here's your blanket. And let me close the bed for you.
At night, while the house sleeps, Puan Naziha doesn't. She tosses and turns, her face tense with pain. Every moment hurts, her back ache, sharp and constant. She clutches her side, trying to stay quiet, but the struggle shows. Sleep doesn't come, only discomfort, only silence and pain. For her, night is no longer rest, it is a quiet battle that never ends. Suddenly,
Hannah, help me!
Yes, Mom. Why? Are you okay? Why, Mom? Are you okay?
No, my back is hurt. I think I need to go to the hospital now. I need to go to the hospital.
Okay, let's go, Mom.
Puan Naziha then rushed to the hospital with her daughter. At the emergency waiting area, Puan Naziha patiently waiting for her name to be called.
It hurt.
Puan Naziha?
Yes, yes.
Okay, Puan Naziha, you can go to room number 3 to see the doctor, okay?
Assalamualaikum, Puan Naziha. Hi, Puan Naziha.
Yes.
I'm Dr. Diana. I heard that you fell. Can you tell me what happened?
Yes, I fell down in the bedroom 2 weeks ago. But I already go to the clinic and the doctor gave me the painkiller. But after I take the painkiller, I getting better. But now it getting worse. I can't bear it anymore. It's so hurt at my back. It feel like someone is stabbing over and over at my back.
Alright, Puan Naziha. Let me examine you. I will press lightly on your lumbar spine. So, if you feel the pain, please let me know, okay?
It hurts.
Oh. Okay, Puan Naziha. I think you need a X-ray. So, I will request to radiographer for X-ray lumbar spine to check for any fractures or abnormalities.
Okay.
Before beginning the X-ray examination, the radiographer prepared the room for the patient.
Okay, Puan Naziha, can you stand up? I will help you. Right now, we will take your lumbar X-ray.
After finish the X-ray examination, they go back to the consultation room to meet the doctor.
Hello, Puan Naziha. Can I see your X-ray number?
Yes.
The doctor then see her X-ray film and give her diagnosis.
Puan Naziha, your X-ray suggests there may be a compression fracture in one of your lumbar vertebrae, but it's not clearly visible. We'll need an MRI scan to get more a detailed look, especially at your spinal cord or your surrounding soft tissue.
Is it serious, doctor?
We'll know more after the MRI, but with the pain you are describing and your fall, it's possible you have had a minor fracture or some swelling in the bone. MRI will help us to confirm that.
Alright, doctor. Thank you.
After the discussion, the doctor met Puan Naziha to ask her to stay overnight in the hospital.
Puan Naziha,
Yes.
you need to stay overnight in the hospital to prepare for your MRI procedure tomorrow. Is it okay?
Okay. Okay, thank you, doctor.
Alright.
The next morning in the radiology department. Assalamualaikum Puan Naziha. I am Fatiha, your radiographer for today. I will be assisting you for MRI lumbar spine examination. Before we proceed with the procedure, I want to ask you few safety questions. First, do you have any metal implants?
No.
Do you have any pacemaker in you?
No.
And then, do you have any history of joint replacement?
No, I have.
Okay, next, I want to make sure, do you have any metal accessory with you?
Yeah, I will wash.
Okay, we need to remove the watch and we will put in the storage room, storage box first. Okay, next, I want to ask you, do you have wear any dentures?
No.
Okay, Puan Naziha, next question, when is your last period?
Last week.
Last week, okay. Since you already in hospital gown, so we will just proceed with the examination, okay?
Okay.
Okay. Puan Naziha then entered the MRI examination room to do her MRI spine procedure. But before that, we need to do the room preparation. For MRI room preparation, I will ensure there is an emergency button, headphone for patient. Next, there is blanket and anterior coil for lumbar spine. Now we can resume with the examination procedure. Puan Naziha, I want to share few facts about MRI before we begin the examination. So MRI use a strong magnetic field to create detailed image of your lumbar spine. So this examination usually lasts long for 30 to 90 minutes. So you need to remain still throughout the examination to avoid a blurred image. Okay?
Okay, I understood.
Alright. Okay, here I will give you the emergency button. If you have any discomfort or you need us immediately, just press this button and we will come to this room as soon as possible. So you just need to press. Can you practice the press? Okay, this will produce sound at the outside, so we'll notice you lah. Okay, next we will give you the headphone. Since the MRI will produce a quite loud sound, so this will help you to stay calm and relaxed, and you will be more comfortable. Now I will put the anterior coil for your lumbar spine to produce a better image. Okay, do you have any question before we proceed with the examination? Okay, now we will start the examination. First, I will push the button and move you into the inside of the gantry. The radiographer then pushed the button to move the patient inside the gantry. Then the CR is adjusted at the center of iliac crest, which is corresponding to the L4 and L5 intervertebral disc space. For this procedure, the standard sequences that we use is T1 weighted, with the purpose to see bone and soft tissue characterization, and the technique used is T1 fast spin echo. Next, we use T2 weighted to see the detailed anatomy including ligament and tendon anatomy. The technique used is T2 fast spin echo. Lastly, we use T2 weighted fat saturated for the assessment of inflammatory changes and fracture. The technique used is T2 FS fast spin echo. After 1 hour, Puan Naziha's MRI procedure was completed. Okay, Puan Naziha, you already finished your examination. Now after this, you can go to meet the doctor at the consultation room. I will remove the coil. Now you can get up. After the MRI procedure, Puan Naziha met the radiologist for the consultation.
Okay, Puan Nazia, thank you for waiting. I've reviewed your MRI scan thoroughly and I'd like to explain what we have found.
Okay, doctor, is it something serious?
So let me explain. The MRI shows that you have a compression fracture at your L1 vertebra, which is one of the bones in your lower back. There's about 20% loss of height, especially at the front of part of the bone. That's why you're feeling this sharp stabbing pain.
Is it dangerous, doctor?
The good news is that the fracture is stable. It doesn't affect the back part of the bone, which means the spinal canal where the nerves and spinal cord is not being compressed. There's no nerve root involvement and your spinal cord looks completely normal.
Alhamdulillah, I will not be paralyzed.
No, not at all. That's why we did the MRI to make sure this is likely a result of your fall, and although it's painful, it can be treated without surgery in most cases. For now, focus on resting, avoid bending, lifting, or long period of standing. Use a lumbar support pillow if you sit and apply warm compression to ease the pain. The orthopedic team will follow up and guide you further.
Okay, thank you, doctor. I feel ease now.
You are most welcome, Puan Nazia. We are here to help you recover fully step by step. Now for treatment, the first step is pain management and rest. We also refer you to the orthopedic team and they may recommend a lumbar brace to support your spine and help reduce movement during healing.
Do I still need to stay in the hospital?
Not necessarily. If your pain is manageable with medication and you can move safely at home with some assistance, you can continue treatment as an outpatient. But if your pain becomes too much or you notice any numbness or weakness in your legs, you must come back immediately.
Oh, I understand. I never had back pain before.
It's very common for people your age to have weaker bone, especially in women like you. We also check your bone density later to see if you have early signs of osteoporosis. Just be safe.
Okay, thank you, doctor.
After a long day at the hospital, Puan Naziha finally came home. She felt a sense of relief even the pain was still there. But now she understood it and that gave her peace.